Welcome to Pharmacology Lectures. We are continuing the sympathomimetic drugs, sympathomimetic system. Now we are talking about beta adrenoceptors. This response is totally different from alpha receptors, okay, and are characterized by strong. We have studied the stronger affinity was isoproterenol, then epinephrine, and norepinephrine. These are divided into beta 1, 2, and 3, okay. Now beta 1 have equal affinities for both epinephrine and norepinephrine. Beta 2 have higher for epinephrine. A tissue with more beta 2 receptors, they are particularly responsive for circulating epinephrine, okay, which is released by adrenal medulla. Now binding to neurotransmitter and at any of these three types, beta 1 or 2 or 3, it will result. What is the mechanism of activation of adrenalyl cyclase, and it will increase the concentration of CAMP within the cell. Now distribution. Tissue such as vasculature of skeletal muscle, okay, skeletal muscle have alpha 1 and beta 2. Beta 2 are predominant there. Other tissues have only one. For example, heart, it has predominantly beta 1. Now the distribution of receptors, we can easily recognize its effect. It is useful to organize a response according to the receptor type. The type, if you know the type, and you know the drug acts on which type of receptor, it will be easy to identify the physiological responses. Now such as alpha 1 receptor produces vasoconstriction, skin and abdominal viscera, and increase TPR, total peripheral resistance, and so increases blood pressure, okay, alpha 1. Beta 1 stimulation will cause cardiac stimulation, it will increase in heart rate. Beta 2 causes vasodilation in the skeletal muscle. Beta 3 are involved in lipolysis along with beta 1 and also have effect on the dorsal muscle of the bladder. We can also have a look at this table, it's very important. Now adrenoceptors, four major types: alpha 1, alpha 2, beta 1, and beta 2. Alpha 1, vasoconstriction, increase peripheral resistance, thus increases BP, mydriasis, dilation of pupil size, increase closure of internal sphincter in the bladder, okay, it acts in the bladder, eyes, and vessels, increasing BP. Alpha 2 inhibits the release of norepinephrine, inhibits the release of acetylcholine, inhibits the release of insulin. Beta 1, it acts on heart, cardiac muscles, tachycardia, increases the heart rate and increases lipolysis, we have also seen, and increase myocardial contractility and increase the release of renin. Beta 2, it causes the opposite action of alpha 1, vasodilation. Now opposite vasodilation, increase peripheral resistance, here it will be decreased peripheral resistance, and thus it has bronchodilation effect, therefore it is used in asthma. Increased muscle and liver glycogenolysis, increased release of glucagon, here inhibition of insulin, and here increased release of glucagon, relaxed uterine smooth muscles. These are the major effects. If you remember these effects, it will be very easy to recognize the drugs and their physiological response and the reason behind them. Now desensitization of receptor, we have also previously studied prolonged exposure. Desensitization is always related to prolonged exposure. Here when receptors are prolonged exposed to catecholamines, they will reduce the responsiveness. The phenomena is, first, sequestration of the receptors, so they are unavailable for the interaction. Then second one mechanism is downregulation, disappearance of the receptors. Third is inability to couple with G protein because the receptor has been phosphorylated on the side of the plasmic site.